This is the first time I've faced mortality. When I first contracted it and was diagnosed and swab positive, just like every emergency responder and nurse, we can take care of this. We take care of the sickest people out there, and we'll handle it at home. After the first week, I got worse, and I started a whole nother regime of antibiotics and PO steroids, and it didn't get better. And by the third week, I had to get help. It probably took me a good 2.5, 3 days to see any improvement where I thought I was getting better. And that was still walking the length of the bed. My heart would be in the 170s, and my sat would still drop down into the mid-80s. Leaving was scary because I didn't want to get sick again. At home was much of the same. I mean, I was still self-proning. I was doing chest percussion, and I was doctoring for a PE. So I was taking blood thinners, plus having sinus drainage, and just trying to be upright, mobile, and recruit lung to work. I was on home oxygen, tethered to a oxygen generator for 2.5 weeks. So it was difficult. It probably took me a good month and a half to feel safe that I was actually recuperating. And I missed over 3 months of work. Vaccines weren't available when I contracted it. I was well enough that I was able to go and get the vaccine, but walking across the parking lot to the hospital to get it took me a while. I had to take some breaks and catch my breath. Nothing was going to stop me. But yeah, I felt like it was the first step to protecting myself and protecting my family. Much like them, I thought I was indestructible. This is the first time I've faced mortality, and masks, vaccines, scientifically are proven to work. And if you're on the fence, hear my story and protect yourself, protect your family.
Data from the CDC shows us that the rate of hospitalization from COVID-19 is 10 times higher in people who are unvaccinated compared to those who are vaccinated. In fact, the rate of death from COVID-19 is also 10 times higher in those who are unvaccinated compared to those who are vaccinated.
Even if you've had COVID before, taking the vaccine dramatically improves your ability to fight off the infection. The vaccines are highly effective at preventing illness and death.
Getting vaccinated for COVID-19 is an important choice for yourself and for the safety of your family. We've heard lots of stories from frontline public safety personnel about the important decision that they made to get vaccinated and how they've helped to protect themselves and their family.
There's a great deal of misinformation about the vaccines. They are safe and effective. They have been tested in hundreds of thousands of patients and administered to millions. If you have questions about the vaccine, contact a trusted provider, your medical director, your primary care physician, your agency chief.